Welcome everyone and good evening. This is an important panel on the feminist perspectives in evaluations, lessons from the field. We hope to look at the aspects of how feminist perspectives, especially the utilization of the intersectionality framework and ensuring the perspectives as well as the issues of most marginalized communities are reflected in our evaluation results. As we know, in the past 3 years, we have all been living on the aftermath of the COVID-19 pandemic. And the impact of pandemics and disasters especially showed the cracks within our society. And usually it is for us to be able to gear to make the most and most impactful results for these marginalized communities. In this, we have two panelists who will discuss how the feminist perspectives can inform research and evaluation so that a gender and equity lens is applied. The findings of a research study on non-state relief work during COVID-19 crisis in Delhi will be presented by one of our panelists, Mubashira Zaidi, which will also highlight the importance of situated knowledge in giving direction to evidence-gathering questions, the key role played by women and youth groups in needs identification, monitoring the processes, and ensuring accountability. Moreover, the qualitative research design and findings from this study provide key insights toward the design and implementation of gender-responsive intersectional evaluations in the context of crisis. The second panelist will discuss localizing SDGs for furthering sexual and reproductive health and rights and gender equality in select states of India, that is Assam, Gujarat, and Punjab. Using citizen report cards and the evaluative approach enables localizing SDGs, evidence generation with a focus on marginalized communities, and the use of evidence by civil society actors to dialogue with duty bearers. So we will start first with our first panelist, Mubashira Zaidi, who is a research fellow and program lead at the Institute of Social Studies Trust, ISST. In her 9 years of association with ISST, she has contributed to research and analysis in the area of women's economic empowerment, women's work, the care economy, and women's struggles and claims-making processes. Previously, she worked in Mumbai with women survivors of violence through counseling, legal aid, and building community support structures, and organized human rights campaigns related to justice and accountability matters, particularly the International Criminal Court ICC India campaign. She has an MA in social work from the Tata Institute of Social Sciences, Mumbai, and is presently pursuing her doctoral studies at Humboldt University, Berlin. Mubashira, the floor is yours.
Good evening, everyone, and thank you, Siva, for the introduction and setting the stage. And thank you to the organizers of the evaluation conclave for this opportunity. I would like to share my presentation, so I'll just share my screen. Is it visible?
Yes, it is.
It is. I would like to share my experiences of leading research, a study recently that we conducted in ISST. And this was about locating the processes of non-state relief work during COVID. This was to understand what actually transpired, especially among marginalized communities in Delhi, and how did the most marginalized in the cities survive, with no income and no savings to fall back on. Especially when access to food and essential needs was highly restricted. What happened was, just wanted to briefly talk about the motivations behind it. So a few researchers from ISST, there were also key members of this organization called Action India, and some youth members of youth collectives belonging to different communities had come together under the umbrella of Maqam Delhi, and we were coordinating relief work. And in the face of all this suffering and the experiences we were having and the challenges that we were facing in coordinating relief work, we felt that this experience had to be captured or documented in a certain way, or there has to be an exercise to reflect over these. That's how we got into this idea that we need to set up a research study. And soon after the lockdown, we started thinking about the study, and we put in a proposal which had these research questions, and which were basically meant to understand what transpired, what were the processes and challenges. And we looked at 4 slum communities in Delhi. Our team members are working in different slum communities, but we selected 4 slum communities. And we explored questions keeping in view the different motivations, social positions, and the situated analysis in that different actors represented in those situations. We also wanted to understand different networks like us that had come up during that crisis situation. We developed a qualitative study which used a case study method. And the case studies corresponded to the 4 slum communities that we had selected. And we conducted in-depth interviews, which totaled to 121, which averaged to 30 interviews in each site. These were all in-depth interviews. While designing and setting up the study, especially, we were very, and also the tools that we were going to use, the team composition, we were very conscious of the analytical framework that we wanted to use in this, in this study. This was the analytical framework. We used 3 conceptual tools, actually. The first one was feminist standpoint theory, which talks about the tool of situated knowledges. So basically, FST, the feminist standpoint theory, has 2 basic arguments. One is situated knowledge, and the other is epistemological privilege. So the standpoint theorists believe that the knowledge that is available largely in the form of scientific findings is biased, because there is androcentrism, there is a male bias. For this reason, they claim that experiences of the marginalized, especially including women, if informed by feminist theory, provides potentially a more complete and less distorted knowledge. So the other thing is that situated knowledge is not seen, is different from a general perspective or a viewpoint. It is a critical consciousness of communities. So it's not based on individuality, it is based on certain collective reflection. And it is the subjects who produce that knowledge are supposed to be in the same causal plane as the object of research. So therefore the team composition and the people who are part of the study lived and worked in those areas. So then we see that FST is actually challenging the dominant preference of distant, dispassionate neutrality in knowledge creation. The other hypothesis of FST is that there is a the social disadvantage implies an epistemological advantage, which basically means that unless and until knowledge is lived and embodied, it is a distorted knowledge. So therefore, it is important to go to people who live in these intersections of everyday practices of power to produce knowledge. Coming to gender responsive intersectionality, we have realized through our feminist studies that gender as an analytical category is not enough. Black feminists and women of color have highlighted that there are different other realities as well that intersect with gender. So patriarchy, capitalism, communalism, casteism, all of these co-constitute each other and have a reciprocal relationship. The other literature that you were referring to was social reproduction and specifically the care diamond. We wanted to contribute to this literature because after all, what we were seeing and witnessing was a crisis of care. So we wanted to understand the care diamond specifically in the in a community context. When we study the literature, we realize that there is a lot of northern centricism. There is a conceptualization of care which is coming from the global north. And we wanted to bring in dynamics of care within a community setting. So this was the analytical framework. This is to give a glimpse of different intersectionalities involved in the study. And this is only a glimpse from the study locations that we have. The 4 communities that we chose, Yamuna, Khadar, Seelampur, Bhavana, and Sanjay camp showed some variance in living conditions. People living in Yamuna Khadar, for instance, were living through land conflict. And despite living there for generations, paying rents, were seen as encroachers from a privileged eye. They were also living from one crisis to another. So there were demolitions, they had to face demolitions, flooding in the area, and then there is COVID. So when we came in with a perspective, with an understanding of COVID as a crisis, for them, there were several other crises that they had gone through and they were living through. Seelampur had seen horrific communal violence just prior to the lockdown. And one man-made disaster, they were dealing with it and they were struck with another. This was a mixed community of Hindus and Muslims, while Yamuna Khadar was largely Hindus. And we saw that there was a lot of feelings of being threatened by Muslims, because they continuously faced scapegoating and discrimination even during the COVID times. People here too, like in Yamuna Khadar, were daily wages and were in petty businesses. This JJ colony, Bhavana, which is a resettlement colony, it came about as a result of beautification of Delhi based on elite aspirations. And like other slums here too, material conditions are poor. Women are also work in factories here, but in hazardous conditions. There have been news of fire breakouts in the area, in the factories. Then the Sanjay camp here. This is an unauthorized area adjacent to Dakshinpuri, which is a resettlement area and slightly better than Sanjay camp. So there is a continuous comparison between the two. Again, very deplorable conditions, and women are largely domestic workers or home-based workers, men are daily wagers. This was to understand the different actors involved in our study. So the actors were important to understand because the subject position or the social position of the actors was key in influencing the care services or the relief work that was happening in those areas. So community leaders comprised of, in our context, largely young men who had emerged in that instance as leaders, and they were organizing and volunteering, the relief effort. Very interestingly, there were very few women who had volunteered or had emerged suddenly in this context as leaders. That was against our assumption. We had thought that women would be community leaders who would emerge in these circumstances, but we did not see that. Community-based organizations that were working there, but rechannelized their resources. There were youth groups again. There were slum-based collectives like Basti Suraksha Manch, and then our key partners Action India was there with the Mahila Panchayat. So they were there in the community. There were also NGOs who were not always working in the community, but they provided the social capital to, to organize funding or connect people. So they were bringing in a lot of social capital and also a lot of understanding on how to prioritize or rather a more gender responsive understanding of how to locate recipients. There were also other actors like state agents, ASHA workers, Anganwadi workers, whom we thought will be very active in those areas, being state agents for care work, but somehow they were quite conspicuous by their absence. There were political parties, of course, there was police and all of those things. The recipients here, very visibly, there were women who were queuing up for collecting these resources. But apart from those highly visible people, women largely, the identification of the recipients depended on the motivation or the orientation of the other key actors. So like the Mahila Panchayats prioritized vulnerable women, while youth groups we saw were prioritizing unemployed people, migrant workers. So there were these different orientations, and when they were coming together, there was this web of relationship that was being formed. Key learnings from the study, because there's not much time, I'll just quickly jump to what were the, when we were applying these concepts, what were the learnings for us and for the future application in research studies or evaluation studies. One of our main effort was to democratize the relationship between the subject of knowledge and object of research. We wanted to narrow that down because often in research context or evaluation context, people from outside come to evaluate or do the study. And often we hear that, when the respondents say that, "Mujhe kya milega?" I say, "What will I get out of it?" Because they're not involved in those studies at all. So our idea was to reduce that gap. The gap always remains, but to reduce it by team composition and by involving the different team members from within the community in design of the study and carrying out the study as well. We were faced with, when there was a lot of data that got collected, we also collected data on the context, media reports and all of that. We were facing with a multiplicity of standpoints and situated knowledge, and everyone in that context was marginalized. So how do you say which standpoint is something that we need to include in our findings and the other is, so that was a challenge that we were facing. But we did kind of code the data, continuously do feedback and reflection, look at how, because in situated knowledge, you need to actually, not every viewpoint is knowledge. We need people who are politically engaged in sub-capacity, over negotiating in the community and all that, and were non-discriminatory. So we use certain principles to decide how and how we're going to present. And of course, when we were coding and all that, the patterns started emerging, and so that was one thing. Also, we realized that with such an approach, we cannot go in with a ready research design and tool. It continuously evolves and it is iterative. So that was something that we needed to keep reflecting as a team. Also, the idea, the other idea was strong objectivity, which we felt was really helpful in understanding what this data is, again, around political engagement. And so what was happening is a lot of team members and people we were talking to were part of collectives, were part of some form of political engagement. I don't mean by political parties. I mean when they negotiate in the community and express. So there is some critical reflection on their roles. Also, we refrained from this was a big learning for us. We refrained from getting into causal relationships of this happened, so this happened, that kind of cause and effect relationships we were not getting into. The idea was to understand, to learn, and to maybe get into patterns and propose things and recommend, but not in terms of, because we realized from this conceptualization that no knowledge is perfect or complete. There is always partial knowledge. So you cannot base your entire argument on partial knowledge. So that was on situated knowledges. On intersectionalities, we are also, again, we realized that it was an evolving process. We did a lot of contextual research beforehand, and we got some idea of social locations. But as and when we talked to more and more people and the narratives came in, we realized there are many, many more social locations and intersections within that. And that was very evolving. But the main I think the impact that we had as researchers and as a team was the realization that there is a sense, we were aware of our privilege and also our subjugations, where we could talk or not, and how will we be seen or not. So that awareness was very key, that was also adding to our own understanding of ourselves as individuals and as the team. Just to come to some key findings from the study, because the study was, after all, to understand the care crisis. And but one thing we found, that the idea of situated knowledge from feminist theory was very important to understand power structures, and especially for understanding micro mechanisms. Whose conceptualizations prevailed, whose idea of care prevailed, how were the needs decided, who were the recipients that were prioritized, because there were limited resources. There was variance in the way care was characterized and the language of care. Definitely gender differences were there, because when we talk to women frontline workers, they talked of how the community is the family, and they're providing care because they think of their own family and they think of others as similar families, and so they were extending their primary role as a care worker in the family to the community. The youth, interestingly, saw themselves as useful agents. They thought they were being useful in that area. So it wasn't about, I am extending, there was lesser altruistic feeling, more among women than in the, so there were these, and there were also religious and cultural expressions around, how care is done. So that was very interesting for us. We also, so in the care diamond, we realized that community, which is really not understood. There is a lot of concentration of the literature on women's role and their unpaid care work, and within the unpaid care work, child care. But here we see there were a whole range of care services that were needed in the community and in families. That was a key understanding, and we need to study more of these community level engagement that happens to understand care. We also realized that community plays a key role in bringing social capital. There was a lot of gap from the state, from the individuals, from the market. But when the community came in, they were bridging that gap, and they were redistributing care, because without that, would have, the resilience of the community was really poor. So also very interestingly, the NGOs, the people who were slightly outside of the community were not so present in the unauthorized slum communities, but they were there in the authorized communities. So how we decide or how the collectives emerge and what kind of collectives emerge was also seen. Migrant workers, which were highlighted during that period, were going back to the villages. They, when we interacted with them, we realized they were going there because they could foresee care and social reproduction coming from kinship relationships that were available in village and not in the cities. Social distancing, aggravated issues of social cohesion, like in Selampur or in other areas where there were this othering of communities. And again, communities are trying to build in that social cohesion by, handling the misinformation and providing resources. What key, one key thing that we've realized is that the government approach of one size fits all is really ineffective when it comes to care, because care is really interactive process. It's a very dialogical process, and it is co-produced by the carer-caree relationship. And therefore, PDS has to be universalized. You cannot exclude people on the basis of whether they have, some certain documents or not. Housing came in as one of the key care material, in terms of material resources. Housing came in as a great is a very important issue for these workers. So there was a lot of understanding on the kind of claims being made from there and around care and what we need to promote in this literature. I think that's about it from me. Thanks.
Thank you so much, Mobashira. I think that was really very, very interesting and exciting because, I think the framework that you utilized, brought out so much of insight from the different communities. And from that, you also have learnings on how recommendations of how policies and programs should be rolled out, to marginalized communities, right? So I think that it was really exciting to listen to that. So for our second panelist, we have Dr. Nilangi Sardeshpande, who is an Ayurveda graduate with Masters in Health Sciences and a PhD in Social Sciences from TIS Mumbai. Her doctoral research focused on women's access to health services with references to young women who underwent hysterectomy. So currently, Nilangi is the project anchor for the Sahaj project, Evidence-Based Civil Society Action for Gender Equality and SDGs. And Nilangi previously conducted research on the issues such as health equity, nutrition, and regulation of the private health sector. Nilangi is also a member of the COE of South Asia and also a member of Common Health, which is a coalition for reproductive rights and safe abortion. So Nilangi, the floor is yours to share with us your findings and studies and implications.
Thank you. Thanks a lot. And thanks, Mubashira, for that interesting presentation. Just a minute, I will share my screen. Yeah. So good afternoon, good evening to everyone. Basically, what I'll be talking about is the Sahaj's experience of localizing sustainable development goals with a specific focus on the sexual and reproductive health rights and gender equality. So basically, when we talk of localizing SDGs, I think it is very important to understand that it is a process of defining, implementing, and monitoring strategies at the local level for achieving global, national, and subnational sustainable development targets. It involves various concrete mechanisms, tools, innovations, platforms, and processes to effectively translate the development agenda into results at the local level. Basically, Sahaj is a Society for Health Alternatives, which has been working in the field since 1984. And the common strand for all the work that Sahaj has been doing is a conscious focus on marginalized and deprived communities with an attempt to make a difference to people's lives and social processes. And in this regard, actually, the work on the Sustainable Development Goals is a natural progression because as we know that the Sustainable Development Goals talk about leave no one behind. So with this perspective, actually, we started working with Equal Measures 2030. We are the national partner of Equal Measures 2030 on the Sustainable Development Goals. So basically, initially when we were discussing with our partners about SDGs, one of the common issues we observed during all the discussions was that though a lot of processes were happening at the global and at the national level, and in fact at the level of policy and programs also, we realized that several of the programs that had come post 2015 were actually directly addressing the sustainable development goals, and they were actually planned to achieve the targets under the SDGs. However, at the local level, the communities which were working on these programs, or the communities were but not at all. They were clueless about that this is the global agenda, and these are the targets, and the programs have come to actually achieve the targets. One example we often take, that the Jan Dhan Yojana, which was launched with a big fanfare, and like everyone was account was opened in the name of most of the family members. And then when we realized that there is a sustainable development target, that number of people with bank accounts, it became very clear that this scheme has been launched to achieve this target. However, like I said, at the local level, the communities were not aware of this. And so we felt that probably this is an opportune time to actually engage the communities who are working on these issues with the SDG agenda. And secondly, when we talked about evidence-based advocacy, that was another learning through the process, and also observation that when it came about data or evidence, probably communities, their comfort with understanding data or analyzing data was a little shaky. Like they felt probably the numbers is not what they are comfortable with. Maybe they can work with the communities, but translating that experience into knowledge or in knowledge products was sometimes seen as a challenge. So basically, with these two initial learnings, that the communities need to understand these global agenda, and they also need to be comfortable with the evidence, creating the evidence, and also understanding the already available evidence. We started this work. And since Sahaj has always been focusing on sexual and reproductive health rights in its work, so that is one of the key areas of work that Sahaj is doing, along with the work on education and other aspects. So we decided that we will work on these two goals, specifically focusing on maternal mortality and sexual and reproductive health rights and services. We also focused on the target 5.3, which was like eliminating harmful practices. So we did some work on the child marriage issue in India. Basically, what we thought that after this work, what we will be able to achieve is definitely, like I said, the local level organizations, their knowledge, their engagement with the sustainable development framework will be better. Their understanding of the processes that are happening at the global levels and how they are connected with their local level programs, that knowledge will be very clear. And very important is the evidence from the grassroots should be fed back into these national processes, and also, if possible, in global or regional fora. So that was the expected outcome. And like I said, leave no one behind is the tagline of Sustainable Development Goals. And Sahaj has always been working on marginalized communities. So we kept that focus on, and in all the states where we worked, we tried to include the communities, the organizations working with marginalized communities, and bring their voices into the evidence that we are generating. And use of gender lens, and was definitely because we are partners of Equal Measures 2030, and Equal Measures 2030 has come up with SDG Gender Index. So we also continued the same focus in all the work that we are doing for bringing local accountability for achieving the Sustainable Development Goals. Just a sec, there is some. Okay. Yeah. To achieve the goals of like localizing SDGs, one of the foremost things was like the partnerships with local and national organizations and networks like Common Health, that Siva mentioned during my introduction. So Sahaj is already a member of several other organizations like Feminist Policy Network, or Common Health, and Jan Swasthya Abhiyan. Along with our other work with these partners, we decided to do the work on monitoring of sustainable development goals. And one of the important strategies was evidence generation. And it was quite clear to us that evidence is not just what is brought out from the government reports like National Family Health Survey or other such studies that the government does, But the experience of the local committees is an important, local communities is an important piece of evidence. And we thought that we should have a mechanism for actually bringing both these pieces of evidence together when we talk about the progress of SDGs. So the process we followed was actually we prepared reports for almost 4 states in the first phase, which includes Gujarat, Punjab, Assam, and Madhya Pradesh, where we had extensive consultations with the local level organizations. And we had a very consultative process to decide that what are the key issues that need to go into the report when we talk about the Sustainable Development Goals. I'll just give one example that when we were doing the consultation in Gujarat, actually as part of the target related to harmful practices, there were several organizations spoke about witch hunting. So initially, as researchers, we had not thought of this issue to be included in the report, but it came so strongly from our partners that we had to, like, we incorporated in our final report, which was then used for the advocacy. So basically, these consultations were very helpful for us to actually identifying the issues which are important for the local communities and to make the report and the evidence generation more participatory. Then capacity building, like initially I said that there was some reluctance to use the data in the advocacy for the local organizations, just because they felt probably using Microsoft Excel or preparing all those reports is not something they are interested. But along with Equal Measures 2030, we had these data for advocacy workshops. So basically these workshops were very helpful for creating that comfort and confidence with the numbers. And I will give one example, like Sahaj's partner in Gujarat Forum, they work with LGBT issues. And after this training, actually, they felt so confident that they went and took up a very quick survey where they looked at all their members and like they interviewed the members to find out that who all have the requisite government identity cards like Aadhaar card or so they prepared the list of members who are missing these cards and presented these to the government functionaries and got the cards immediately. So they were so happy that when they went with that clear evidence, they were very able to get the outcome quite easily, as against just going and saying that we are not getting the ration or anything because of lack of Aadhaar card. So capacity building was seen as like we found that is a very effective strategy for localizing SDGs. And third, I like the amplifying voices and strengthening accountability. So there were very, like in Assam, for example, there were issues of tea garden workers and all. So many of these issues we felt that were missing in SDGs, because even if the focus is on leave no one behind, the current mechanisms, the way the government is collecting the data, the marginalized voices of the marginalized is not getting captured in that. So for the evidence generation, again, like this COVID pandemic has actually affected the achieving of SDGs quite quite an extent. So we did our research on how actually access to maternal health and the SRHR services for adolescent and young people's access was affected during COVID pandemic. And again, these studies were done with the support from our local partners, and the designing of the studies and also the data gathering and analysis, the entire process was done in a participatory manner. The second also, like I'm saying, state level report cards, we thought of actually monitoring the SDGs through a feminist lens. And for that, we actually selected the topic, which was the theme, which was relevant for that state. So for Assam, like we talked about maternal health, because Assam has the highest maternal mortality. And for Gujarat, we did the work on report card for young people's sexual and reproductive health. Similarly, with Equal Measures 2030, we did these fact sheets which spoke about contraception, education, law and workplace equality. So throughout these issues, if we look at the feminist perspective, guided the choice of issues, guided the choice of indicators. So that's how the whole piece of evidence generation we have been doing around SDGs monitoring. Similarly, we also found that when we are talking about achieving programs, achieving targets, it's very important to see whether we are allocating enough budgets for that. And so one piece of evidence generation was also around budget analysis. So I'll just talk briefly about Assam as a case study, because though we did it for 2 states right now, because of paucity of time, probably I'll just talk about the maternal health. So we were quite aware that for evidence generation, even though creating an index would be the best, like ideal situation, but for the lack of time, and also given the complexity of the entire exercise of generating index, and to make it more participatory, it is better to do it from a community monitoring perspective, or preparing the report cards. But we chose maternal health as the theme for Assam, because we found that maternal mortality, because the maternal mortality is the key issue for Assam. So through the lens of maternal health, we actually mapped all the sustainable development goals, and then we looked at the progress of Assam for SDGs from the lens of maternal health, and we tried to analyze that how the state is doing, not just for the goal 3, which is related to health, but also for all other goals. So actually, this figure looks little complex. It is, but I'll just say that when we were doing the framework for analysis, we looked at the individual attributes like reproductive health related targets, such as knowledge and access to contraception, knowledge and access to menstrual protection, or adolescent pregnancies, all these individual attributes. At the same time, we also looked at the family and peer influence. So what are the structures of decision making at the family which are actually stopping women from accessing maternal health care, and also the issues related to access to resources such as cooking fuel, electricity, water and sanitation. So, and all these data we took from the government reports, and plus some micro studies which we used. Then we looked at the community context, like what are the social group wise differences, and like Bashira was saying, that gender is just one aspect, but we need to look at the caste, class, age, even education, religion, rural, urban. So some of these other aspects of inequities we tried to study, and the health system related factors. And then the wider gamut of issues like around access to education, the overall GDP expenditure on health, and all these things. So I'm just saying that this whole structure or framework for analysis, we try to look at from the different indicators which are important from the feminist perspective and gender perspective. Just a minute. Actually, am I audible?
Yes, you are.
Yes, you are.
Yeah, actually my slide is not moving. Just give me 1 second. Yeah. Yeah. So I'll just wrap up quickly, because I will not read out the indicators. But so, like I'm saying, when we were discussing that what indicators we should use, so we use the feminist lens to decide that which indicators should be included in the report card. Yeah, so there were indicators which were directly related to maternal mortality and other services for antenatal care, delivery related services, and postnatal care. Similarly, the other direct indicators was related to the health system. And then we talked of other goals and other indicators which are relevant for maternal health, like poverty and maternal health are closely related, or is hunger, anemia, access to food, PDS, all these issues are also directly impacting the women's health, women's nutrition. So these indicators were included. The indicators related to education, equality, access to water, sanitation, energy, even decent work and economic growth, like women's participation in labor force, then decision making, and all, and access to resources. So we looked at the progress of Assam for various SDG targets from maternal health lens, and chose the indicators which were relevant for maternal health out of these sustainable development goals. Now, while doing so, actually, on one hand, we got very good, uh, the engagement with the partners was very good. And everybody realized that, okay, whatever work they are doing is actually related to a larger global agenda. And so that connection was quite strong by the end of our session, like consultations and all. But one more challenge is that access to gender disaggregated data, because when we are talking that we are doing this analysis from a gender lens, at several places we couldn't get the gender disaggregated data at the state level. Then second, again, reliability of secondary data, that during actually COVID times, there are several reports which have not been updated. So there was a challenge in actually doing a real-time kind of report cards. And then again, these are the common challenges we see, that acceptance of evidence provided by civil society. So whenever we are doing these dialogues, and if we present our evidence, they will say you are done only in in few villages, and so that level of acceptance is still not there, even though government says that leave no one behind is the SDG agenda. And also there are challenges with getting the policymakers for dialogue, especially in last 2-3 years. I think everything, all these structures of the mechanisms for dialogue also got disrupted because of COVID, and there were no offline meetings were possible, and obviously meeting the policymakers online wasn't that effective. Yeah, so like I'm saying that how what are the key feminist aspects in what we were doing. So which themes to be included and which particular targets to be included was guided mostly by feminist perspectives. Again, like I said, leave no one behind. So we tried in every state, we tried to identify what are the marginalized groups in this state. We got in touch with the organizations who are working with these marginalized communities, and tried to see that what kind of evidence is available with them and how that evidence can be integrated with these report cards. So giving voice to the excluded and marginalized groups was one of the ways we tried to actually do these state level report cards. And participatory, we try to keep it as participatory as possible, all these evidence generation activities. Yeah, thank you.
Thank you so much, Nilangi. This is also very interesting because, in comparison to Dr. Mubashira's work, yours was like more overarching, looking at connections with the global development agendas and monitoring and evaluating against that. So I think for our next, for the discussant, we have with us Amanda Austin, who is the Senior Advisor on Global Engagement, Equal Measures 2030. She helps drive Equal Measure 2030's global engagement and ensures that the SDG Gender Index, which Nilangi also mentioned, are reaching the right global stakeholders to help drive gender equality up the global agenda. Amanda has been one of the EM 2030 team members who has been with the initiative since the very beginning. She's recognized as having played a hugely significant role in making EM 2030 the initiative that it is today, and brings a rare mix of strategic vision and getting stuff done. So she's full of energy, a team player, and a feminist leader. And I'm quite sure that she's going to bring all of the points that were brought up by Mubashira and Nilangi and relate it to the gender index as well. Amanda, take it away.
Thank you so much, Siva, for that wonderful introduction. And I'm honored to be among the speakers today and as part of this conclave. It's interesting. I found myself noting down pieces that Nilangi and Mubashira had mentioned because they resonated so strongly with what I think Equal Measures 2030 was trying to do with the SDG Gender Index. And the two pieces that really jumped out at me was that phrase around how all knowledge is partial. And so there's a humility in our approach to an understanding of evidence and data when we come at it with a feminist perspective. And that's just as true when we work at a global level, even more true when we work at a global level to think about how to create a tool or a piece of evidence like the SDG Gender Index that Nilangi mentioned. And the other piece is around thinking about the relationship between a research subject and a research object, and how do we navigate that as feminists and as feminist researchers and evaluators. And I think, again, when we think about the way that Equal Measures 2030 built the SDG Gender Index with partners like Arrow, with Siva, with partners like Sahaj, with Nilangi and Renu, we think about how do we design something that is a tool that's meant to be used by and useful to women's rights organizations, feminist movements from the very beginning. So how do we build that together in order to make sure the questions we're asking ourselves and the product that we create is actually something useful, helpful, reflective of realities in as much as it can be, and how do we supplement it? So I'll just say just a couple words about what the index is, and the way in which we try to tackle those two challenges around partial knowledge and around research objects versus subjects, and how to align and bridge that. So the index itself is the most comprehensive tool out there for measuring gender equality in line with the Sustainable Development Goals. It's got 56 indicators in its latest iteration across 14 of the 17 goals, and covers 98% of the world's population of women and girls in 144 countries. So the first question that we sort of tackled as a partnership is, what is an index for, and what are its strengths and what are its limitations? So it's useful for looking at comparability, for looking at global trends, for looking at the way in which certain goals are moving faster than others in countries or in regions or globally. But it's also incredibly limited, especially when we think about things from a feminist and intersectional perspective, because by its very nature, it's a global data tool, and therefore it needs to think about data and evidence in a way that is comparable across hugely different contexts and situations and different groups of marginalized individuals within different countries. So it is inherently limited. And it's limited not only by that desire for that comparability or the requirement for comparability, but also by enormous data gaps that everyone is more than aware of. Around gaps in data on women and girls living with disabilities, in gaps on any kind of ability to think about gender in a non-binary way at a global level when we look at data. So we started out, when we were building this global evaluation tool really about gender equality, to first to think about it in a very pilot setting, and to only work with 5 or so countries so that we could deep dive on these different contexts with both policymakers and advocates in those countries to think about, what is this tool for? What do we want it to do? What are its negatives and drawbacks going to be? How can we mitigate those? And so we did it in that way, and we combined that with surveys conducted with our partners, with policymakers, with wider groups of civil society, to try to understand, what issues do we need to see here? And something that was so important that sets this index apart from really any other index out there on gender equality is the desire to reflect the whole person, the whole woman and girl, and all the ways in which these different development issues are impacting their ability to achieve their rights. And I think that's where something like Nilangi was saying about drawing the connections between maternal mortality and all of those other indicators that need to be taken into account when we think about whether or not maternal mortality is changing. That in a microcosm is what we were trying to think about across the whole of the SDG Gender Index when we think about the ways in which gender equality and climate intersect, taxation intersect, and also the issues that so many of us work on: violence, health, sexual and reproductive health rights. So when we were doing these discussions across all of our partnership and beyond, it came out really strongly that we needed to be comprehensive, not reductive, not only pick 10 indicators to look at a global level to try to understand progress on gender equality. And the second piece of that is that we didn't limit ourselves when we looked at gender data gaps. We didn't limit ourselves to the issues that are included within the official SDG framework as indicators by the UN, because we know that there are so many data gaps in that, both in the data not being collected, the data not being disaggregated, not insufficient numbers of countries reporting on that data. So when we designed it as a partnership, we use about 4 out of 10 of the indicators in the whole of our framework out of the 56 are from the official framework. But actually that means more than half are from complementary sources. They're from things that we look at, perceptions-based surveys done by Gallup, for example, on whether or not women are feeling safe walking around at night, or whether or not they're satisfied with the level of healthcare that's available to them. So we look at issues like that, both because it helps us fill data gaps, but also because it allows us to look at intermediary indicators that don't just focus on an outcome, like whether or not maternal mortality has dropped, but whether or not more women are saying that they're accessing services or more women are receiving antenatal care. So it helps us look at those intermediary steps that eventually are going to lead, hopefully, to those changes in outcome indicators, but allow us to tell a much more nuanced story about the way that those smaller changes can happen and have then a knock-on effect on the eventual outcome indicator. Because of time, I just want to talk a little bit then about how do we, not just in the design of the index in the first place, but then how do we work with partners on the other side? Because I think both Mubashira and Nilangi really focused on this, is how do we not just create a product, and we can do that in a feminist way, in an inclusive way, gets us a great product, but then what's it for? How do we make sure that it doesn't sit on a shelf as a piece of evidence that we feel good about and was great, but then isn't getting back to the people that need to see it and need to be able to use it? So for us, it wasn't just an upstream activity of working with our partners and civil society and policymakers to make a useful tool. It's about the socialization that we then do afterwards that both recognizes what an index is helpful for and what its limitations are and what we can do about that. So even a partner like Arrow, for example, that was looking at doing regional level assessments on SDG 3 and SDG 5, Arrow did a great job thinking about, okay, what's useful from the index that we can pull in for Asia, but then what other indicators do we want to bring in that tell a much more comprehensive story around what SDG 3 and SDG 5 is looking like in terms of progress in the Asia region. Very similar to what Nilangi and Sahej and Renu and the team there were able to do to try to socialize that global level tool, use it as a helpful framework, and then add to it to help also mitigate some of those challenges, to help shine a spotlight on the groups that are going to be lost in a national aggregate number. So we also saw that in Kenya. Our partner there did a very similar approach to Sahej in terms of creating subnational scorecards that allow us to look much more deeply at what something looks like within more marginalized areas within a particular country. And so I think just in conclusion, I think we almost see the same challenges, but even at a bigger level when we try to make something that is truly feminist as a data and evidence tool at a global level. But I think that Equal Measures 2030 as a partnership, the way that we have done that and the way that we've been successful is solely through working with our partners like Sahej, like Arrow, like all of our partners around the globe in order to try to build it in the first place, and then therefore be well positioned to use it and to enhance their own existing work and make it that much stronger. Thanks, Siva.
Thanks so much, Amanda. And I think that, really part of the feminist process is actually, building that partnership, right? How we work together is as important as what we work on together, so thanks for that. I think that this panel was supposed to be 1 hour, but I think that perhaps we can give 5 minutes and perhaps we can stay on just for 5 minutes to see if there are any questions from the audience, because, and I'm sure there's quite a lot. So I just want to make sure that those questions are also heard. Do we have any questions? Well, okay, since I don't, you can ask questions, utilizing the raise hand option, which is in your reactions, or you can put them in the chat box. Okay, so anyway, so since there are no questions, I guess we can close like on time. And I think as a brief close up, I'd like to say that, Mubashira, Dr. Nilangi, Amanda brought different aspects, of what does it mean to have like, a feminist intersectional view on evaluation and how this can actually lead to more nuanced and more strategic approaches in how we do work and want to create outcomes for most marginalized communities. And I think, so many of the takeaways is like, how do we actually, sometimes even, wherever we are working, we are very much, how do I say, driven to make that broad conclusions, right? And how in a world, that is set by so many crises, as Mubashira pointed out, I mean, like communities are not just lived through the COVID-19 crisis, right? That almost on a very regular basis, communities are facing crisis and on an almost an ongoing way, right? And for these communities in crisis, especially, how utilizing that feminist intersectional lens and framework really enables us to understand, the challenges that they are facing from their own eyes and their own lens, right? I mean, so that knowledge that is situated in these communities, and how the feminist approach is actually liberating that knowledge, right? And being for us to be able to witness and understand what is really going on. And I think that, of course, a huge challenge lies in like asking policymakers to actually be able, to provide that nuance, right? When they're rolling out that programs and their policies. But I think that, the work that has been done so far, both by Nilangi and by Mubashira, I mean, actually helps, like, because, widens the ranges of options, right? For example, like who is recognized as the head of household, what type of work are households doing, what type of other elements and dimensions of care in a household, how does this actually affect and intersect, those global health issues, like whether it's violence, whether it's, maternal mortality or access to health services. So, and I think that, as, how do I say, the world becomes more sensitized, for the need for such approaches, to really make a difference on the ground. We can only hope that, the feminist approach is embraced by more stakeholders. So thank you everyone for joining us. It was a very interesting and exciting panel. And thank you for taking time to join us. With that, we can close the panel. Thank you so much.